back, everyone. You know, it is cold out there, and when it's cold out there, that means what? Colds. So here to help us talk about the flu, the cold, and more is Brandon Fischer, Health Commissioner for Allen County Health. Well, welcome, Brandon.
Well, thank you for having me.
All right, so there's been an uptick on the flu, on COVID, on you name it.
Right. Yeah, we're just seeing a lot of cases of flu, hospitalizations being reported to us. So those are the primary ways that we see cases reported to us is through flu hospitalizations, and it's not just your typical group of individuals who seem to be older with underlying health conditions. We're seeing a lot of people who are presenting to the hospital pretty sick, who don't necessarily have those underlying health conditions, are younger, and it's one of those that we're kind of concerned about it. So we just want to make sure that everyone's aware, one, that we're seeing increased cases of flu going on in the community, but second, do what we can to prevent it. So if you are sick, stay home. Wash your hands frequently, use hand sanitizer when you're out in the community, and cough and sneeze into your elbow just to protect yourself and protect others around you. We lost 6 pharmacies in the community that offered about 4,000 flu shots in our community. We at the health department and our hospital partners tried to pick up some of that gap, but to make up for 4,000 flu shots, I know we did not make up for that at the health department. So it's one of those that we're still encouraging people to get that vaccine, but it's a little tougher when you have communities like Adelphus or really within the city limits of Lima losing most of their pharmacies or all their pharmacies. So it just makes it tougher to get into an urgent care or get to our offices to get those flu shots, but we do have them available. It won't prevent you from getting sick, but it's going to prevent some of the more severe symptoms with the flu. So it's just one of those that we're still encouraging that in addition to the other preventative measures to avoid some of those complications from flu. We were just talking before we went on about this being postseason. In high school basketball, you don't want that team to get sick and have one night where they get sick and then tournament's over. So that's one way that you can protect. Not only that, if you have an interest in anything high school girls, high school boys, or wrestling, you don't want someone to get sick and then end their season, unfortunately, because they got sick.
Exactly. Let's talk about norovirus, because a lot of people don't even know what that is. So explain what that is.
So norovirus is just a virus that's connected to basically food intake. So you can get it through someone who doesn't wash their hands after they prepare food and contact with food while they're preparing it, and then you ingest it. And then it can lead to both vomiting and diarrhea at the same time. It's pretty serious. It's not a condition that's normally reported to us, but we hear from our healthcare providers, we're seeing more and more neural. It is one of those diseases that leads to outbreaks in some of the congregate facilities. So our long-term care facilities also report when they have outbreaks of norovirus to us. And again, it's one of those, our guidance is pretty similar. Wash your hands before you prepare food. If you're not feeling well, don't prepare the food. Let someone else take it, or get takeout that night if you're not feeling well, because you may not feel the adverse effects of it, but someone else may really be impacted by that ongoing vomiting or diarrhea that they have, and it really can be another one of those things that puts you in the hospital if you get too dehydrated.
Once you get it, you got it, and it just has to bide its time, right?
Yeah, once you get it, you got it. It's a couple days of real discomfort. Try to keep pushing fluids so you don't get dehydrated, because it's a big thing that really impacts you when you have it. It clears out, but it is one of those that it leads to a great discomfort and can impact your health for a while.
Yeah, let's talk about bird flu real quick, because you know it is in our area now. It's especially in the Mercer, Darke counties, and we have our first human case in Ohio. How worried are you about this, about spreading, or you know?
The main concern that I have is just the spread in our chickens, our turkeys, ducks, and those commercial farms, and the impact that that has on that. This virus is one that spreads through those birds real quickly and has a major impact, but it also is impacting some of the wild birds and geese that are flying around on an ongoing basis. We're fortunate so far that there has not been an additional human case that's come out of the avian influenza in Mercer County. The individual who got it was someone who was working in one of those barns and clearing out the deceased poultry that they had from that avian influenza, and just had that exposure there. So it's a big thing that we're trying to do outreach to reach out to these farms that do have these chickens to make sure that they're not getting in a situation where they could have that potential virus get in there exposed, because it goes through pretty quickly, but then it can also have a major impact on the individuals that are working in there if they're not using adequate PPE. So that's the big concern that I have there. As far as the general public, if you do see a dead bird, leave it alone. Ohio Department of Natural Resources is the place to call. They can come out and take a look at it, and they can do some testing on that. The Ohio Department of Agriculture is working with our farms, and if there's concerns on maybe some smaller scale farms, they can look and see if they can do some testing on chickens. I know we've had some close calls with some backyard chickens where people are just getting their eggs and selling them on the roadside, where 1 or 2 chickens get sick, and they're just trying to look out for that. So just do what you can to protect yourself. If you do have an exposure to a chicken, you feel like you have signs and symptoms, you can always reach out to our office, and we can coordinate with the Ohio Department of Health to make sure that that's not something that's going on with you. But as far as concern in humans, right now, pretty minimal, but we don't want it to get in there and have those mutations where it turns into another situation where we have flu going through the community. This is one that there is no immunity to it, so it can be serious. We hope it never gets to that point, but it is one that we want to try to limit where it's at.
Thank you for coming on today. I appreciate all your knowledge and helping our community understand what to do best to keep themselves safe and healthy, right?
Well, yeah, I appreciate you having me, and welcome back anytime.
All right, thank you. All right, well, don't go away, because we have more when we return.